Good evening. Welcome to yet another session of the AMS sessions, which happen every Tuesday at 9 p.m. live on my YouTube channel. Okay, so normally how it happens is I talk for about 5 to 7 minutes about a topic, and then it is open to questions, and you can ask your questions, any questions, and I'll try to answer those questions. Okay, so good evening, namaste. Thank you, Cynthia. Nice shirt. Yep. Okay, so let's start our sessions today. So today we have got, so we finished the Purva Karmas of the Panchakarma, and we had an overview of Panchakarma. Today we'll start one by one into the Panchakarmas. Okay, so today we have got Nasya. Okay, so these sessions happen every Tuesday at 9 p.m. on my IST on my YouTube channel. So Panchakarma, today it is Nasya. Okay, so let's just go through initially what about Panchakarma and all those things. So Chikitsa or treatment is basically divided into two. It is Shamana and Shodhana. Shamana is pacification while Shodhana is purification. And the Panchakarma come under the purification part of the treatment. And when you look at Shodhana or the purification, you have got Purva Karma and the Pradhana Karma and the Paschat Karma. So Purva Karma is basically preparing the patient for the Panchakarma or the important Karma, the Pradhana Karma. So that includes Sneha and Sweta. That means lubricating the person and then making the person sweat. It's called sudation therapy. So these are the two things of Purva Karma. And the Pradhana Karma that is what we are going to look into, the Panchakarma. And Panchakarma means 5. You have got, 5. And today we are going to talk about the specific thing about Nasya. Okay. So Nasya, when you look at, you have got Nasya, Vamana, Virechana, Vasti, and Rakta Moksha. Okay. Nasya is the administration of medicine through the nasal passage, through the nostrils. And Ashtanga Hridaya, when it explains about Nasya, it says, Nasa hi shiraso dwaram. Shiras means the head. Okay. Towards the head. Okay. Nasa hi. He means specifically it's the one. Okay. The. Nasa hi. The only opening towards the head. Okay. Towards the head. Okay. Is the Nasa hi shiraso dwaram. That is the dwara or the opening towards the head. So it's very important for us. That's the reason why the administration of medicines through the nasal passage is very important. Okay, and it is good for all diseases above the urdhva jatru vikareshu. Vikareshu means it is in saptami in. Okay, vikara means diseases. Urdhva jatru. Jatru means above the neck. So anything above the clavicle. For all diseases, Nasya is very important. Okay, so when you look at Nasya, other Panchakarmas, okay, let us leave aside Rakta Moksha. Rakta Moksha can be done anywhere. But if you look at Vasti, Vamana, or Virechana, it is done for the body, the main trunk, okay. The head is called what? It's called Urdhvanga, okay. That means the upper body. Anga means the upper limb. Uttamanga, otherwise, that means the best limb. So this is supposed to be a separate limb. And so when all the other three, Vamana, Virechana, and Vasti is basically for the trunk, Vasti is for this limb, which is called the Uttamanga or the best limb. So any disease which occurs, it can be eyes, ears, nose, teeth, gums, throat, hair, okay. If you have got any issues above this, Nasya is the right treatment for you, Panchakarma treatment for you. Now we'll see the types of Nasya, okay. When you look at the types of Nasya, you have got Virechana. That means Virechana, that which does a lot of cleansing. So Virechana Nasya. Okay, then you've got Shamana Nasya. Shamana Nasya is pacifying. If the doshas are not too much, then you can pacify it. And then you have got the Brahmana Nasya. You have got the nourishing Nasya. So when you look at, as I said, when you look at the other Panchakarmas, okay, like Vasti, yes, one part of Vasti. Otherwise, if you look at Vamana, or you look at Virechana, or you look at bloodletting, Rakta Moksha, or to a certain extent Vasti, Sneha Vasti is slightly different. None of these things can be used to nourish the person. It is, when you look at, they are part of Shodhana, right? You are actually cleansing the person or de-nourishing the person. But Nasya is something which you can give. You cannot give Vamana to nourish a person. You cannot give Virechana to nourish a person, but you can give Nasya to also nourish a person. Okay, that's why we consider Nasya very important, and it is for the whole head. It can de-nourish you by doing Virechana Nasya, or it can also nourish you by doing Brahmana Nasya. So you have got Virechana Nasya, you have got Shavana Nasya, and Brahmana Nasya. And what do you do for Virechana Nasya? Mostly, okay. For Virechana Nasya, you can use powders, strong powders, you can use juices from plants, and you can use oils. So sometimes people feel that for Nasya, we can use only oils. No. Anything, you can put anything inside the, you can, there's called Mapana Nasya, where you, Churna Nasya, you blow powders into the nostrils. So you can use anything to do Nasya. So when it is thick, when it is sharp, you use powders. Okay, so strong powders, juices, or oils can be used for Virechana. If you want to pacify, you'll use mild things. Milk can be used. Even soups, animal soups can be used for Shamana. Ghee can be used. Oil can be used. But when you are doing Brahmana, same thing, if medicated ghees or oils and other things can be used for nourishing this part of the body. Okay, so this is very important for you to understand. Now, apart from that, there is again one other classification of Nasya, which is Marsha Nasya and Pratimarsha Nasya. Okay, Marsha Nasya is where we use in large quantities, which is mainly meant for the Panchakarma or the cleansing processes. Okay, but if you look at the Pratimarsha is small doses for daily administration, or if you want to do Shamana or Brahmana, we can use the Pratimarsha Nasya also. So Nasya is something which is very important. So what even for Nasya, when you do that, we normally do a little bit of steam inhalation, and you see that the kapha, all those things are slightly, they melt a little bit, and then you have got a position in which you lie down, your neck hanging down, and then you pour the medicines, and you massage it a little bit. You turn to the side and get up. Okay, if at all you have got a little bit of phlegm and all those things, that is basically a Marsha use. You use large quantities of medicine. You can see the phlegm and all those things come to the back of your throat. You can spit it out. You do that consistently for quite some time, you can get this whole place cleansed. And once that is cleansed, then the kapha goes down, right? That is when you have to slowly start doing the Shamana, or after a point of time, you should do the Brahmana also and start nourishing that area. Okay, so that is basically an outline about Nasya. Now you can start asking your questions. Okay, there are already a lot of questions. Good morning, Gary. Yes, showering after Abhyanga. I heard you say that you shampoo every 7 or 10 days, but wash the hair during shower after oiling. While washing, do you use soap or just water? I use just water and no hot water. Okay, if it is very cold, or I have traveled to a place which is very cold, I use lukewarm water. I never pour hot water on the head, and it won't be even warm. It'll be slightly, I don't know whether the right word English, it might be tepid, slightly warm. I use that to rinse my hair really well. I feel at least 50% of the oil goes with the water, and then when I use the towel to wipe my hair, another might be 10, 20, 30% of the oil goes. Remaining oil stays on my scalp, and it nourishes my scalp and the hair roots. Okay, so that's it. Okay, Gary. We have frozen amla. What is the ratio of salt to water for brine? I would say, if you've got frozen amla, for 1 liter, if it is 1 kilogram, okay, you can use, as much as, it depends upon the kind of amla you have got, because some people, we get small amlas which doesn't occupy actually a lot of space. So I would say you use enough water to see that the amlas, the water level covers the amla. Okay, you don't have to use more than that. Just a little bit of a thing which covers the amla. What happens is when you add salt into it, the salt actually sucks water from the amla, and you'll see the amla shrink a little bit, and that it will also add a little bit more water into the brine. Okay, so I would say you can leave for a minimum of 1 month, and then you can start consuming the amlas. Cynthia, nice shirt. Thank you, Cynthia. Sir, last time you mentioned about an Ayurvedic doctor for cancer in Pune. Could you tell his name? His name is Dr. Pankaj. Okay, if Samriddhi, if you can, probably if you're on Instagram, okay, if you can send me a direct message on Instagram, I can share his contact details with you, his email ID and his phone number. You can directly reach out to him. His name is Dr. Pankaj, and he works with the Dinanath Mangeshkar Hospital. It's actually an allopathy. It's a modern hospital, but they have got a fantastic Ayurveda wing which is dedicated for cancer, and it's one of the best hospitals in Pune. You have got specialists, cancer specialists, modern cancer specialists, and Ayurveda cancer specialists working hand in hand. Every case they sit and discuss, and wherever needed, they treat only with Ayurveda or they treat only with modern medicines. So this Dr. Pankaj is a very good doctor for cancer treatment. Okay, Samriddhi, you can send me a DM. I can respond to that. Which herbs increase strength and testosterone? Ashwagandha. Okay, so testosterone, if you look at the hormone testosterone, if you want the testosterone to directly go up, then you have to take a chemical thing. But testosterone is basically, if you look from an Ayurvedic perspective, okay, we have got the Saptadhadus, Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra. It is a contribution of the Shukra Dhatu. If all your see, and how does the Shukra Dhatu form? Shukra Dhatu forms only when the Rasa, from the Rasa Dhatu, through the Rakta, Mamsa, Meda, Asti, Majja, reach the Shukra Dhatu. The travel of the Rasa all the way to Shukra is very much necessary. Okay, and that is basically called Rasayana. So when you do Rasayana therapy, or day to day when you follow certain routine, your testosterone automatically improves. But if your testosterone level is extremely low, then I would say you have to go through the Panchakarma treatment and get those blocked removed. We don't know why it is happening. It might be some avarna happening somewhere, somewhere some blockage is happening, that it is not flowing down properly. Okay, otherwise I don't want to tell you, okay, ashwagandha definitely will increase libido and all those things, but it is not something which is specifically increase testosterone. Okay, even kapikachu, okay, you can make a note of it, that also promotes all these things, but that is not the right approach. I would say you have to see why. Okay, so you have to cleanse it completely so that the rasa seamlessly flows from rasa all the way up to the shukra dhatu. Okay, Tejeshwara. Why are cancer cases increasing so much? What precautions can be taken on personal level to avoid cancer? See, sometimes, let me tell you this thing. In my opinion, my personal opinion, it might be due, see, we are exposed to a lot of chemicals here and there. Those things do add. But in my opinion, I don't think that cancer cases are going up extremely high. But the difference is that they are being reported more. In the sense, people are more aware. Once they find some issues, they go test for something and they discover that they've got cancer. But cancer was prevalent even before. Cancer is also prevalent now. Looking at the ratio of cancer to the population, it's not like diabetes. Diabetes is actually going up more than cancer. So our continuous in a way, our continuous exposure to lot of stress and chemicals day in and day out might be one reason why, if at all, cancer cases are going up. That's one major reason. And I would say, precautions, even people who have lived a great life, very disciplined life, also end up having cancer. But I would say, if you are disciplined as to what you're eating, or you're not knowingly, you are not getting exposed to any carcinogens, people, even there's something called occupational hazards. If you're working in a place where they are nuclear things happening. Even where imaging happens, like X-ray or CT scan or scanning centers, I would say you are more exposed to things which can cause cancer. So avoiding all those things are very important. Then getting directly exposed to things, people, like tobacco or excessive alcohol, or certain kinds of foods, especially processed foods, and all those things are not very good. Okay, so you can keep away from those. Apart from that, if you are disciplined, if see how does a cancer cell develop? It's because your body is not able to control the growth of certain cells. So by and large, if your body is healthy, it can take over a lot of things. So I would say focus on general health rather than let thinking of how do I prevent something which might come to me later. Stay away from carcinogenic agents. So this is the only thing which I can tell you, and start living a very disciplined and stressless, I can't say stress free, stressless life. Looking around at people, heart attacks, cancer, kidney failures are just becoming so common. I have started to feel anxious and helpless that factors causing these are not under control. What do you say? So I just answered that question, Samurji, right now. Heart attacks, it's most of the things you have written, can heart attacks, kidney, lot of these things are, lifestyle issues. Stress is one common factor in all these three things. Then the kind of foods you eat and your sedentary lifestyle and all those things can add to all these issues. And heart attack, you see heart attack, yes, heart attack just comes like that. But one thing you should understand, that heart attack, even though it just came like that, it is not something which just happened. It was building over a period of time, maybe 10 years, 15 years, by your lifestyle, by your things. But sometimes any tests, any kinds of tests and all those things might not be able to catch it. Sometimes you might be unlucky, that you might not be able to catch it. Heart attacks, you went through a test, everything was fine, when suddenly it happened, then that it was slowly building. Stress is one major factor. Okay, so let us not be anxious as to what is going. It may basically, what happens with human beings is, right, they if you are if you are from a major city and you see city development happening, you would have said, "Array, if I had bought that plot, if I had bought just one ground of land over there, maybe 20 years back when it came for sale, it was dead cheap. Now it became 20 times or 100 times, and you're always in that. Always that conversation comes, when people sit together, that's there in your mind, oh, had I done that, had I purchased that. So you are either living in guilt or like, anxious, what is going to happen to my children after they grow, or what happens if I get heart attack. You are either living in guilt in the past, or you're anxious about the future. You are not living in the present and not doing what you're supposed to do in the present. Let us focus on these things. Simple things, you can become healthy. What is the best option for Graha Chikitsa online and offline? I stay in Maharashtra. No, Graha Chikitsa, for people who don't understand, Graha means your stars, okay? So lot of Mani Mangala, homas and all those things come under Graha Chikitsa. Okay, Bhuta Chikitsa also it is called. So I would say, online and offline, it all depends upon people's belief system. A lot of people don't believe in, astrology or the stars and all those things. For people who believe, you can actually approach a good astrologer, okay, and then try to get your horoscope done and see what is going wrong. Okay, and see, let me put this one thing very clear. I sometimes, when a patient comes to me, I do the treatments which I feel is the right for that person, and sometimes I fail to see results, the kind of results which I expect. Then I ask them very clearly, do you believe in, astrology or something? They said, yeah. If they say yes, I tell them, just show your horoscope to a good Jyotishi and try to see what is happening. So they show them, and he says, do this, do this, do this, do this, do this, and I ask them to do that also. And what happens is, along with the treatment, if you club this, I've seen very good results. Okay, so let me put it very clearly here. It is not that the astrologer did a huge thing. So probably, they would say if you do this, it is again freeing that person from whatever karmas he did. If you say you would have done that in your past life, whatever it is, he says you do this thing, all those things will be clear. So it's basically trying to handle him psychologically also. So we do treatments for the body and all those things. And when his mind is also taken care psychologically, you will see fantastic results. Okay. It is not me being superstitious and 100% believing in astrology. No, but these are things which we have to do to see that the patient gets better. For us, the health of the patient is more important. We'll do all things to see that the patient gets okay. So online, you will get a lot of guidance from different kinds of people. I think you have to search for them. Okay. Maharashtra, I don't know who is there, but otherwise, in Kerala, we do have people who take care of such things. Okay, and they are available online also. Hi, too many questions, Samriti. Do you believe the psychiatric options of Manorog are mostly caused by bad childhood, family, environment, or bad company? See, Manoroga, if you look at Manas, the mind has got three gunas, the Sattva, Rajas, and Tamas. Okay, these are states of the mind. Okay, these are gunas. I didn't say doshas. Okay, but if you look at the doshas, Sattva is never a dosha. Rajas and Tamas are doshas. And so when you are sometimes in good company, and what happens when your upbringing is good, your confidence is high, your sattva is slightly on the higher side. Okay, so when your sattva is slightly on the higher side, it is very difficult for you to get afflicted by certain things which happen around you. That means they are classified as manorogas. Okay, so when we look at the treatment of manorogas, Ashtanga Hridaya says very clearly, Dhi Dhairya Atmadi Vijnanam. Manodosha Aushadham Param. Okay, Dhi Dhairya Atmadi Vijnanam. Dhi is buddhi, or sitting with them and trying to explain to them that the realities of what is happening. That is basically counseling. Okay, see that and dhairya next to dhi, that is counseling and getting the right knowledge into him. Dhairya is confidence. Dhairya is giving him strength. That means anything goes wrong, I am there for you. The family is there for you. The society is there for you. Not ridiculing him or putting him down. Always, it will again bring his sattva down. So dhi dhairya Atmadi Vijnanam, and let him try to get exposed to a lot of spiritual things, so that actually gives him a lot of confidence. So Ayurveda explains this very clearly. When you go to Ashtanga Hridaya Uttarasthana, a lot of treatments have been told for manorogas. Okay, it can be done. How to apply oil to scalp directly? Too much oil gets wasted on hair. Yes, I would say that it is good for you to take a little bit of oil, heat it, warm it, and then apply it onto the scalp. The scalp is where the life is. The root is also in the scalp, so that is where you have to gently massage, and then give a good massage to the scalp. Applying oil on the hair, it doesn't help too much, at least for hair growth. So normally what I do is I apply oil on the scalp, and I ask people who have got longer hair, apply oil well on the scalp, and then use a wide tooth comb and comb your hair so that the oil can be spread to the hair. There is no need or no point in applying too much of oil on the hair. You can just and so when I take a shower also, as I said, I don't shampoo too much. So when I pour oil or water on the head, the oil actually flows down onto the hair, and hair automatically gets that sheen because of the oil. So applying oil on the scalp is more important. Rub it really well. Don't do fiercely. Gentle rubbing on the scalp so that blood supply comes in. Your hair growth will be good. Scalp health also will be better. After waking up, should you drink warm water before or after brushing teeth? Tisha, I would say it's always good for you to brush your teeth really well. Okay, let me put it this way. As far as brushing your teeth goes, cleaning your teeth, very important. But what you put inside your mouth is also important. So at night, I would say, after you have had your dinner, immediately after your dinner, you go and brush your teeth with your favorite toothpaste, whatever it is. Okay, the reason is that your stomach is full, your body is satiated, absorption is very less from the buccal cap, from the oral mouth. So when you're using those toothpaste, it's all chemical based toothpaste. So absorption from this mouth is very, very less. You do your tongue scraping and all those things and go to bed, so that your oral cavity is very clean before you go to bed. Get up in the morning. Okay, when you get up in the morning, you are fresh, you are hungry probably, and the first thing in the morning, if you put that chemical toothpaste in your mouth, the body has got a very high chance of absorbing it from your skin, buccal cavity. Okay, so I would say rather you can use fine, Ayurvedic tooth powders, which I generally do. I just apply it on the gums and on the teeth and wait for about 10-15 minutes, and then I wash. So morning, my brushing the teeth in the morning is for freshening up, and cleaning happens at night. Okay, and I would advise you not to use that chemical toothpaste early in the morning when your body is asking for something. Don't drink tea, coffee. It's the same thing, using a chemical based toothpaste is equally bad or even more. Okay, use something which is natural, and then drink your water. Okay, let it be clean before you drink your water. Next one. Aishwar. Kunkumadi Taila Nasya for Palitya. Okay. Yeah. So Palitya and Khalitya and Palitya, these are two conditions. Okay. So Khalitya is you losing hair, and Palitya is basically your your hair whitening. So Kunkumadi Taila. Okay, it might be surprising for a lot of people that people use Kunkumadi Taila on the face. Okay, for good complexion. But if you go through the Palashruti is when you go to the reference, you can do that. You can go home and do that, or you can check it on Google. When you go to the shloka of Kumar Tailam, after everything has been written, it also says it is for external use, and it can also be used for Nasya. Okay, so the Paka, or the when we make the Taila, when do you have got Paka? I mean the steps of cooking the oil. Okay, that's called Paka. That's the easiest way for you to understand. So oil is prepared. So when the oil is not very thick, the first stage of when it is ready, it's called Mridu Paka. That is where the oil you take for Nasya. And then when it reaches the next stage, Madhya Paka, that's the oil we take it for internal. And next stage is the Khara Paka, the third stage. That is where that means it gets thicker and thicker. Okay, and that is where we take the oil out for external application. For Kunkumadi Tailam is basically taken the first stage or the Mridu Paka, because it can be used for Nasya, and it is very good. It has been mentioned for Palitya or whitening of hair. Yes, you can put 2 drops every day in the morning. It is also good to increase your complexion and your buddhi. You can use Kunkumadi Taila as Nasya. Okay. Joyful Strider. Wow. Namaskaram, Doctor. Does Jalneti come under Nasya? Any update on your basic Ayurveda course when are you about? 2 questions. I know. Okay. Let me answer the second one first. Yes, we are working on that, and just give me some time. It might not be there this financial year. Okay. It might be we might probably coming up with that. Wait, please bear with me. Might be April, early April, or mid-April, we might be coming up with that course. We'll keep you posted. Okay. Now, second thing, Jalaneti. Normally, Ayurveda does not mention Jalaneti. Jalaneti is a variation of cleansing through the nose. Okay. So, like, you also see Vamana, or you also see Virechana and all those things when you do yoga practices. It is an adaptation from Ayurveda, which is not very, very strenuous. Okay, so Jalneti is basically you tilt your head, and you've got a Jalneti pot. Now you call it neti pot. You pour a saline water through this nose, and then it comes out through that nose. Okay. The thing is that you will definitely get your nasal passage clean, but Nasya goes much beyond that. When you're pouring oil and you're pulling it in, it also gets into your sinuses. Okay, and your sinuses are also cleansed because of Nasya, which generally doesn't happen due to Jalneti. It goes through this nostril, comes out through that nostril. Okay, even when you put the cloth and clean also, basically it doesn't get into the sinuses. Okay. Higher amounts of protein are being promoted now. Since protein promotes growth, would this contribute? Will this contribute to? Okay. Now, let me try to. Higher amounts of protein are being recommended, but I would not recommend it to anybody. If you are somebody who is aspiring to take up bodybuilding as a sport, then you will have to build a lot of muscle. Okay, mamsa dhatu. Then when you take a lot of protein in the form of flesh also, okay, mamsa vartadya. Mamsa increases when you take in mamsa or something which is equivalent to mamsa. Protein, if you take too much of protein, your muscles actually grow bigger. It grows bigger only when you actually exercise, otherwise it doesn't digest at all. So when you look at from the Ayurvedic perspective, you have got sapta dhatu, rasa, rakta, mamsa, meda, asthi, majja, and shukra. If you're focusing only on one dhatu, that means you're focusing only on the mamsa dhatu. What is going to happen to all the other dhatus? It's a good question, right? So I would say let us go balanced about things. Don't take too much of protein, don't cut down too much of carbs, avoid carbs, or absolutely no fat. Let us go balanced, little bit of protein, little bit of carbs, little bit of fats, and good vegetables, good fruit, little bit of, if you're a meat eater, good of meat. Don't overeat it. So let us go through a balanced diet which you are genetically used to and try to stay healthy. Okay, doing something more is always bad. Protein is not very something which is very easy to digest. Most of the patients who come to me are patients who have got problem with their agni, and protein intake, excessive protein intake is one major reason. Why three doshas came into existence? Who decides, or what is the basis of this? Oh, okay. Tejeshwara Murthy. If we look at the Indian signs, we have got 64 kalas. I don't know whether you've heard about this. Kalas are arts and sciences, 64. Okay. The mother of all these 64 kalas are the Pancha Mahabhutas, which the whole world accepts that everything is made of these 5 elements. Okay. Akasha, Vayu, Agni, Jala, Prithvi. Okay. It's made of these 5 elements. So everything, when you look at, for example, when you look at construction, Vastu Shastra, we call that. Okay, what do they look into? They look into the same thing. How do I create space? Where is the air coming from? Wind. Where is the sun? That is the Agni. Where is the sunlight coming? Where is the land very strong where I can construct the house? And where do I get water? So these things are basically the things which we look into each and everything. As far as the 64 kalas go, the mother for everything in India, the science is the Pancha Mahabhutas, these 5. Okay, but when these 64 kalas came into existence, they branched out from all different branches. So they use their own words. So when Ayurveda slowly started coming up, initially they used to use the Pancha Mahabhutas for treating, to understand how a person is and then treating. Then, samanya gunas, things which have got common properties like Akasha and Vayu, they were clubbed together, and that is how Vata came. Okay, it doesn't mean that Vata has got only Akasha and Vayu. Vata is also made of the 5, but when it is predominantly Akasha and Vayu, it is called Vata. When it's predominantly Agni, it's got all the 5, okay. But when it's predominantly Agni, it's called Pitta. And when it's predominantly Prithvi and Jala, that means water and earth, it is called Kapha. That is how the Tridoshas came into existence from the Pancha Mahabhutas. Okay, who decides? In the sense, nobody decides. Your Prakriti is decided. Okay, Shukrartha vaste janmadau visheneva vishakramehe. Ashtanga says that very clearly, in the sense, when Shukra Artha, when the fertilization happens, your Prakriti is decided. Your Prakriti is not put inside you after, might be 3 months or 6 months or after you are born. Just like Visheneva Vishakramehe. Visha, or the poison in a poisonous animal, it could be a snake or anything, a scorpion or something. Snake, the poison is not injected after a certain age, it is born with that. It only matures after some time, right? Likewise, you mature into your Prakriti after some time. So, nobody decides. Your fertilization decides, and that is again depending upon your karma. Purva janma kridam papam vyadhi rupena jayate. Whatever karma you have done, if you believe in that, that decides your prakriti. Hope I'm clear, Tejeshwara. Okay, namaskaram, Dr. Das. Jalniti Commander Nasya. Okay, I think I have answered that question, Karthik. Okay. Jalniti doesn't come under Ayurveda. Namaste, sir. Manjari. I have heard milk and buttermilk should not be mixed with anything like fruits or ragi or powder. Is this true? No. Normally, Ayurveda says very clearly that don't mix anything sour with milk. And if you look at most of the fruits, they have got a sour tinge to it. Okay, how much ever it is ripe, So normally they say don't mix fruit with milk. Okay, that is viruddha ahara. But buttermilk like fruit, I'm not very sure. Ragi or jowar powder with milk, I think you can have if you want to have, or with buttermilk also, I think you can have. There is something called ragi java or something which Telugu people consume. They beat it with buttermilk and have, So I don't think mixing buttermilk with jowar or, ragi is a problem. But my only thing is that, I personally believe that if I am not sure whether the combination is right or wrong, then I tell avoid it basically. If you're not sure, until unless you are sure, because the textbook doesn't say very clearly. So if you're not sure whether the combination is right or wrong, then I would say don't do it. If you're sure it is, then go ahead. Milk and fruit or milk and sour things have been very clearly mentioned. Don't do it. So don't do it. Okay. Which boosts digestion, dry ginger powder or fresh ginger? Both actually increases digestion. Okay, and there are very little differences in the properties of dry ginger and fresh ginger. When you look at from a commercial aspect, ginger doesn't grow throughout the year. It's very difficult for it to grow sometimes, and so what you do is you dry the ginger and keep it, and so you can use it when it is not available. Okay, and the synonym of dry ginger is nagara. Nagara means city. Nagara means from the city, from the town or from the city. So that means normally in cities you don't grow all these things, right? So what is available, what comes from the city is nagara, and the other one is ardra. Ardra means ardraka. Ardraka doesn't mean anything, a herb or something. Ardra actually means fresh. Okay, Shringavera, there's a different other words for it, So something which is fresh is called ginger, and something which comes from the city is called nagara. But if you look at for medicinal purposes, okay, I would say always go for dry ginger, and it's got a fantastic synonym, Vishwa Bheshajam, or the universal medicine. Okay, so dry ginger, in my opinion, if you're looking at cooking and all, you can use ginger. If you're looking from a medical perspective, dry ginger would be a better option. In night after having food, can I brush teeth immediately? I would say that's right. Have your food and immediately brush your teeth. Two advantages. One thing, the absorption of all the chemicals from your oral cavity is kept to the minimum, because you're full, the body doesn't want anything else, you can clean it immediately. Second advantage is that you wait for 1 hour. After some time, if you feel like eating something, you'll feel guilty because you have already brushed. So you'll stop eating or snacking after your dinner. So immediately brush. Okay, keep your oral cavity clean, because if you don't brush, what happens is, if before night, before going to bed, the bacteria are all those things which can cause tooth decay or throat infection, and all those things are everywhere, also in your saliva. So if you've had a great dinner, and if all those things are still there in your mouth, lodged between your teeth and all those things, you are giving a 7-course dinner to the bacteria. Okay, it's not good at all. So keep your oral cavity extremely clean before you go to bed. Brush your teeth really well. Clean your teeth, not clean your teeth really well. and do your scraping of the tongue. In my opinion, do it at night, and then go to bed comfortably. I have seen my father and his brother Prakriti change around marriage age. They became from skinny to fat without doing anything. Yes, Tejashrumurti, I have noted the last three words, without doing anything, because they don't do anything, they basically put on weight. Their Prakriti would not have changed. Okay. They were thin in those days because of they were very active. They were doing a lot of activities. They were running around childhood and all those things. So they were thin. Probably scarcity of food also would have been there. We don't know a lot of things, But the Prakriti of a person will never ever change, Tejashrumurti. Just because they put on weight doesn't mean that their Prakriti changed. Okay, it's not only physical thing here. And the Prakriti, they put on weight because, just like you said, they did not, without doing anything, they probably had a very sedentary life and they put on weight. Okay, but Prakriti will not change. Can we eat banana stem and banana flower? What are its properties? So, specifically speaking, the properties of banana flower and banana stem has not been mentioned. But traditionally speaking, banana stem is extremely good for people who find it difficult to pass motions. It's also good for kidney stones. Okay, if you have got kidney stones, you take banana stem. In Malayalam we call that varapindi. Some people call varathandu. Okay, in Tamil. If you take it, chop it to very, very, very small pieces, okay, and remove that fiber. If you don't remove that fiber too much, it can clog. Sometimes it can be very difficult for you to digest. So as you cut, you keep on using a stick. You remove a lot of fiber from it. And that is also being used for making fabric now. So it is very good for kidney stones and stuff like that. Flour, I don't know. It is very tasty. You can have it. It's got a lot of fiber. It helps you, by and large, if you look at banana, it gives you a lot of strength, and we say that, iron, you'll become as strong as iron when you consume unripe banana. So the same benefits you will get when you take the banana flower also. We call that kodapan or, varapu. Does Ayurveda say about reversing cavity or its permanent damage? Ayurveda does not say too much about reversing cavity, but when it starts as a dot, Ayurveda says that you can actually clean it and you can reverse it, but not when it's already got a hole in it. Once it is hole in it, that means the bone the teeth has already eroded. Okay, and Ayurveda mentions also ways in which you can plug that hole, clean it and plug the hole. So I mentioned in Shalakya Tantra, in Mukha Rogas and Danta Rogas, they have mentioned that how to fill a cavity. Okay, which it is not many people, I don't think anybody does that anymore. Okay, because dentistry has gone to a different level altogether right now. So a lot of people go to dentists and they get it clean and they get, the cavities plugged and all those things closed. So it has grown to a different level. So I don't think a lot of people do apply the Ayurvedic treatment procedures for dental issues and cavities. Okay. So I think with that, we have come to the end of today's session. Next week, there is last question. Okay. This is the last question. Mahavenk. Okay, doctor, do you think at some time Ayurveda and Siddha traditions were imbibed to make the locals adapt bits of both? See, if you look at the principles of Ayurveda and Siddha, they are very similar. Okay, which came first is a debate. It's a big question mark. But I would say, if you look at any civilization anywhere, when people started coming together, definitely there were diseases. And when there were diseases, tribals, you may call them tribals or community living, there were diseases, and there were people, they were smart enough, they were more connected with nature, and they were able to find out what herb could handle what. So they were more into probably, okay, single herb treatments, this problem, this thing, this problem, this thing. Okay, And I would say when people started thinking, when they started seeing patterns, then they started understanding the Panchamahabhuta thing of the herb which is used, the Panchamahabhuta thing of the person, and then they try to, do the opposite of that, and that try to pacify the issue. So that is when slowly, this they started, identifying patterns into it, and that's how the Panchamahabhutas and the Tridoshas came into it. If you look at, Siddha, and if you look at Ayurveda, both Siddha and Ayurveda have got Vata, Pitta, and Kapha. So if Siddha has got Vata, Pitta, and Kapha, which are actually Sanskrit words, So I might be very controversial here. Okay, they consider Agastya as their guru, but mythology says that Agastya traveled across the Vindhya Parvata and he came to the south. So I don't mean that there was no medical treatment there. Yes, definitely there were people living here, there were diseases here, and people were getting treated with the medicine, the local medicines here. And I would say that was Siddhar, and only thing I probably feel that Agastya would have contributed to structuring this thing a little bit. That's the reason why we see a lot of common formulations here and there. Okay, so in my opinion, there isn't too much of difference between the Ayurveda and Siddha, even though the language in which they speak are entirely different. But both sciences are there to help mankind. And even, if you look at Vriksha Ayurveda, how to basically treat a tree. Vriksha Ayurveda, how if a tree is not healthily growing, how to handle that. Vriksha Ayurveda is there, Ashwa Ayurveda is there, Gaja Ayurveda is there for each and every, you have got veterinary science also. Ayurveda is veterinary science, Ayurveda for trees. So it was actually a very developed science for helping, the society at a large. So let us not try to think which came first, or try fighting unnecessarily. Let us use both sciences and see that people become healthy. Let us put people's health as if it could be. You can use allopathy, you can use homeopathy, you can use naturopathy. Okay, you can use Ayurveda, any pati, even just praying to Ganapati also, if you get okay, everything is welcome. At the end of the day, the patient has to become healthy. Okay. Namaste. See you next week with another topic. One more point from the Panchakarma. We finish Nasya. We'll take up something else next week and we can explain that and sit and discuss. Okay. Good night.